Good morning, agents. Your mission, should you choose to accept it, is to define a new era of care. For too long, the greatest challenges in our health systems have seemed impossible. Staffing crises, thin margins, increasing patient acuities, and operational inefficiencies have stood in our way. But today, the game changes. We have assembled the most elite team of leaders from top health systems across the country for the first ever QLive. You've chosen to accept this mission. This is your chance to meet your new AI teammates that can make your mission to deliver exceptional care to your patients possible. This is more than just a conference. It's a 2-day operation designed to equip you with all of the tools you need to transform hospital operations. You'll hear from your peers, those who have been on the front lines, sharing their stories and strategies for success. This is a forum for AI-powered collaboration, where you will not only learn, but also contribute. This year, we're unleashing a new kind of force, a 24-hour live hackathon. We'll put the power in your hands, giving you the ability to select the mission you'll solve. With Qventus's AI teammates and real-life engineers by your side, you will have the tools to tackle a real-world healthcare challenge in real time. Learn from your peers, share your experiences, and see what's possible with Qventus. Are you ready to define the next era of healthcare? Your mission begins now. Welcome to QLive25.
Please welcome CEO and co-founder of Qventus, Mudit Garg.
Well, good morning, everyone, and welcome to QLive 2025. I'm super excited that all of you have taken the time to be here with us. I know it's not easy to take time away from families. We haven't had a chance to have all of you together in person, and it's so electrifying to feel the mission and feel all the work we do together when we are in person. I was thinking our last in-person event was slated to be March 11th of 2020, so you can all guess what happened to that. And we took a little detour in life from then to now, but I'm super excited we got a chance to get back together with this entire crew. I thought for kicking it off, we'll spend a little bit of time walking through our journey. So as you know, Ian and I started doing this about 13 years ago. We thought we'll cover a little bit of our 13-year journey, the lessons we've learned, the mistakes we've made, the iterations we've had to make through that, our collective impact on the work we have been doing together on transforming hospital operations, and share a little bit of the unique moment in time we find ourselves right now in healthcare and how we are evolving our platform to help maximize the outcomes that can come from there. So to start, I'll start a little bit with where we started, which started about like 15, 16 years ago. I was doing a lot of lean process improvement type of work across the country in many hospitals like yours. And every hospital I went to, I would see world-class clinicians, world-class therapies, world-class equipment, and yet the experience of the average patient was far from world-class. It was all the staff doing Herculean, extraordinary efforts to make ordinary things happen every single day. And it felt just untenable that in spite of these heroic efforts, this is where we were. And then as I got to thinking, I was like, maybe it's because of the heroic efforts, because the system sort of never got to evolve to having that kind of reliability all around it. And that was our mission to start with. Somewhat biased as an engineer, I believe data is a big part of how we will solve that. And then how do you use data to drive reliability in those operations? So we can both help the staff and help the patients and alleviate the administrative burden that everyone has to face every day. And as a patient, have the reliability of care delivered to me so that when someone says X will happen, it actually does happen. That was our starting point. We didn't start with AI for AI's sake. When we started, our goal was just to see how can we use data to get those outcomes. And many of you have been with us on that journey in the trenches, helping figure it out right from the get-go. And through that process, we learned many lessons that I'd love to share some of the stories along the way. The first of that stories is all the way back to when we started. We thought, from the lean process improvement standpoint, what we would do is help empower the front lines, have all the data. And if they could have the data, they would know how to unlock and solve the operational challenges they saw day in and day out. So the first thing we did is started to build dashboards. Ian and I, we were still in grad school. We were like, okay, let's try to build what we could do to give people data back. It is a little embarrassing and funny to see this 2011 dashboard back up here now, and the 2011 version of me trying to figure out what we wanted to build in them. But they say in the startup land that if you're not embarrassed by the first version of the product you shipped, you probably shipped too late. So I think we at least did not ship too late. We had a bunch of work. We iterated on this dashboard and actually found a health system where they were doing lean process improvement work in their ED. And we would help give this data back to the front lines every single day. And they used it. You could see a lot of unlock of creativity starting to happen. And then a month went by, another 2 months went by, that lean project finished, and nobody logged in. And it was a real head scratcher. I was like, you said this was so important to the hospital and to all the frontline staff. Why is no one logging into this dashboard? Spent some time, we asked some questions. Ian's background and some of my background was in machine learning, and we started sort of thinking, and we said, we know why. We're telling people what already happened. No one's that interested in what already happened. Most of us want to know what will happen and how do I solve for it. We know the answer. Let's actually build something that can tell what will happen in the ED tomorrow. So this was before machine learning was a buzzword and such. We started to sort of work on that. We weren't sure if that was going to work, but we actually built a model for the ED, and I'll tell you in a second why I have this big image of a full moon up here. So we built this model, we started to work on it, and actually did pretty well. So I was like, this is really cool. So I flew up to Seattle, I go to this ED, I talk to this nurse, and I was like, you won't believe it. We have this model that can actually tell you what your ED volumes are going to be. This nurse, he had a very dry sense of humor. His first response is, does it have the full moon accounted for? I was like, what do you mean? I was like, I think you're pulling my leg, I'm not sure. He's like, no, come with me to the ED. We go to nurse by nurse, and each nurse is like, I am never going to take a shift on the full moon night. I was like, okay, but this has got to be either a large group prank or it's something real they're telling me. I got to go do something about it. So I called Ian sheepishly. I'm like, don't ask me why. Can you just add the effects of the phases of the moon into the model? I'm like, okay, like super weird, but we added. Well, if any of you are wondering, do not staff your EDs based on the phases of the moon. That does not impact anything. But it was a really interesting lesson that till we understood the context of that user, and till we could account for what they believed in, rightly or wrongly, we would not win the trust of the user in that. So even though the full moon ultimately was not statistically significant, incorporating that into the model actually helped that user understand that you are accounting for what I have seen. I might have only seen it once, but that is stuck in my mind, and that made a big difference. So that was lesson number one. Machine learning, understanding the user context was super duper critical. So then we said, okay, this is working. We can start applying machine learning to many, many other problems. We started applying it to things like no-shows in an outpatient clinic. And we started to find the importance of the underlying data and how you manage the quality of it, of all the guardrails you have to build around it. Like the model outputted this 2-year-old was going to no-show, and as I dug into it, it looked like the 2-year-old supposedly was divorced and also smoked a lot. And those were the factors that was causing it to happen. And, it kind of shows you that the machine learning model is doing what it can do. It doesn't know that that is not possible fundamentally. So we tried to build all these machine learning models, and we would look at all these academic papers, and we would see that these models were working and giving great performance. But when you actually tried to build it practically, you ran into all these real-world problems that would then make it really hard. Classic example in OR case length, like all of these areas. So we had to build a lot of pieces around the guardrails. In particular, how the data looks like in real time versus historical was a large gap. It always would make it so that you have nice, clean data looking historically. I know exactly what happened in the OR historically. I build a model based on that, but when you book it, do it at time of booking, it doesn't work. So that was the second lesson we learned. We then started to apply the machine learning to, as I said, more areas, and one of which was in a mother-baby unit. I will not go into all the beliefs of the mother-baby nurses here. I can tell you at the dinner time, and some stories of how I had to ask my parents about auspicious times to have babies to feed into the model. But we took all our lessons, we did all the data work, we took all the work of data quality, we built this model, and this hospital happened to be in the Bay Area, in San Francisco Bay Area, about 15 minutes from my house. So The charge nurse said, I want to know how many babies will be born so I can actually use this to adjust my staffing. Like, okay, that sounds really good. Every day we would predict it in the morning at like 5 a.m. We would see how the day ran, and I would go and get feedback. So this one day, every single hour, our prediction was spot on, which is pretty unlikely, statistically speaking, that is exactly right. I had the biggest smile on my face. I'm like, I'm going to go, and this is going to be the best day. She's going to be so excited about this. So I go to the hospital. I was like, Debbie, how are the predictions today? And they're fine. I was like, what do you mean they were fine? They were exactly right. Like, there was not a single one that was off, even by a single patient. Like, did you adjust your staffing based on that? She's like, oh, honestly, I think I only had 2 minutes before my shift changed. I didn't have time to think about it. What if it was right? What if it was wrong? What if I called someone in and they didn't actually were needed? Like, so I just didn't get time to think about it. I was like, really? Like, it was exactly right. And then as I thought about it, I was like, yeah, I kind of get it. When you're busy, I mean, like, let's say I'm driving and I had a GPS that said 30% chance turning right in 400 meters is a good idea. I would probably throw that GPS out fast, and I'm sure all of you would as well. Because when you're busy and when you have that mental load, last thing you want is think through these complicated pieces of what you do and don't do. So moving from that prediction to a decision, understanding your context, understanding your variables, understanding your risk profile was absolutely super critical. So it wasn't just the machine learning, we couldn't stop there, but actually figuring out what you should do based on that. So it's actually very easy for you to do that. So these learnings taught us about data and the predictions and then sort of optimizing the decision. But we still had some more learning to do. We actually then started applying it to another problem. We had one of the hospitals that shared with us that they had a very high rate of patients falling on the inpatient unit. They wanted to solve that. So again, as I said, we applied our learnings. We actually got data from the bed alarms on the patient beds, from call light systems, from medications that the patient was taking, from nursing assessments that were filled out. And we built this machine learning model that actually could do a pretty good job of in the moment telling you that the patient is imminently likely to fall. Not just they have a risk in the next 6 days or something, but right now they're moving and they're trying to go to the bathroom. Like, this is the moment you have to intervene. So thought, this is amazing. It's real time. It does it in the moment. We took those predictions, we would feed it back and send it to the nurse. Well, guess what? The nurse is not sitting on the computer waiting for this prediction to show up for her or him. And so nothing happened. And we realized very quickly, also obviously, I'm sure some of you still use those. There were these Vocera badges that those nurses used to have. So I was like, what is that? Like, I know you're roaming about, but you have that. What is that? And they told me about it, and they said, oh, well, we have to call an operator. We send the message. Well, we started searching online, and I'm sure they've plugged this security hole by now, but I found that every Vocera badge had an email address that you could email, and you could reach any nurse in the hospital, in any hospital. So we started to quickly code up a system where the prediction didn't go to a generic email to a specific nurse there, and we got the message to the nurse, and patient falls fell by 40%. That was incredible. To see that if you go from the data to outcome, in a use case I didn't think was possible, it was really incredible. And that made probably one of the most important lessons click in our mind, that you have to make the right thing to do, the very easy thing to do for the staff, or it just won't happen, for any of us for that matter. So those were the lessons. We started to learn that. We also started to learn to actually do this well, to go from data to outcomes and understand the context and do all these things well. We had to go deep. So we started to build our solutions from that lens at that point in time. Inpatient was one of our first solutions we built. I think many of you use that. And we started to do that work. And probably about 6-9 months into that, the pandemic struck. I think it's not a period any of us want to relive or reimagine or think about too much. But I think that was a period of profound lessons and learnings for all of us. And for us, it shaped a lot of what we do. I think probably the biggest lesson, I'm sure each of you saw this, is I think I was just amazed by the entire healthcare community, how it banded together, all the change everyone drove, the crises we all fought. And I saw that in our team as well in little ways, where we similarly said, look, we work on hospital capacity, and it's probably rare in one's lifetime that the mission you choose to work on is a matter of national crisis. So what can we do to make this happen? We were not epidemiologists. That was not our area of study. But we had built all these platform pieces to go from data to outcomes. So we started to apply them to new problems. And very soon, we started to use that with about 700, 750 hospitals across the country. Actually, the entire state of Minnesota started to use it. And it was one of the most rewarding times where you could see week by week the challenges we were all facing as a country. We were making a difference on them. We actually had the White House reach out about how to allocate ventilators, which I'll tell you about how the FEMA model worked afterwards, which was not confidence inspiring. So then they said, can you please start sending us predictions of where we should send these ventilators? So we would send these every day. And then one day, we never knew what they did with it. But one day, I get a call at midnight, my time in San Francisco, which is 3 a.m. DC time, that we have a meeting in 3 hours. Can you send us the next predictions? But I wanted to call you today because there is 250 people on ventilators in Michigan and Louisiana today, which we would not have sent if your model didn't push us to do so. And that sort of connection, I mean, each of you were on the front lines fighting this, saving lives. I think for us to see that kind of connection and to see it in an area where we didn't think we would apply the platform ever to, really turbocharged that belief of like the mission the outcomes we could drive and the mission we could drive if we could apply this in more and more places. That started a journey of saying, there's something special in these learnings of how we built the platform to operationalize these machine learning pieces. And that really started to build the DNA on which we built all our solutions and on the work we've done and how sort of the focus on outcomes comes through in all of those areas that we work on. So I want to repeat sort of the 5 foundational truths we learned in that process, because I feel like they've become more important as we look ahead as even they were when we were first working. First is machine learning or AI by itself doesn't drive outcomes. As we shared in many of those examples, it was a lot of everything that surrounded it. The second piece is you have to understand the user's context to really know what to automate. You have to understand the user's context to gain their trust. You actually have to know when do you fully automate, when do you have a human in the loop, what's the risk profile of this use case. So all of these pieces require you to deeply understand a use case to actually do well on that. Some of the foundational, boring things that no one wants to talk about, like data quality or what guardrails happen or how do escalations happen, are some of the most fundamental things you have to solve for upfront. They're not the things you get to see in a demo. They're not the things anyone asks you upfront, but they are the things that make the difference between confidence a user has versus they don't have in what you are delivering. I think the most important and obvious one, as I shared, was making the right thing the easy thing to do. Either that's through behavior science and motivation, and how do you motivate someone to do this action while they have a lot of things going on, or you automate the action that needs to take place and make it very easy for them to just make that happen. And the fifth one that I haven't explicitly shared yet, that I think is actually one of the most important ones, is when we work with all of you, we know the limited bandwidth you have day to day, the limited time your staff has day to day, the limited dollars that exist in the organization to make an investment. So in the beginning, when we started, we would think, if I could apply machine learning to this and someone is excited about it, this makes a lot of sense, let's go into it. But we learned it was really, really important that a good use case didn't only have to deliver margin, didn't only have to be the right thing for the patient to do, but also had to unlock time for your staff, also had to improve quality. So a good use case had to do not one of those things, but all of those things. And then you had to understand the texture of the problem enough to know that you can get good data, you can get good models, you can get all those things. And that, I think, became one of the most important pieces, that understanding a problem deeply and intimately was actually almost as important as any of the work that follows it. And that, I think, has been one of the key principles through which we've built these solutions. And that kind of makes the difference between a prototype and an actual software happen. I think those hard-fought lessons and working with all of you in the trenches has been what's enabled all these outcomes to happen through our solutions. When Ian and I started this 13 years ago, I couldn't have imagined for a better community of change leaders and healthcare leaders across organizations that are academic, community, safety net across the country. So thank you. Thank you for taking time. Thank you for working with us. Thank you for giving us feedback. Thank you for helping us improve and get to a place where we've been able to jointly achieve some pretty remarkable outcomes together. We looked at some of the data. We've, over the last year, touched almost 750,000 surgeries. We've been able to move about 40,000 patient surgeries earlier than they would have been able to have it otherwise. We've saved almost 50,000 excess days, which I computed it's about 130 years worth of excess time the patients would have spent in the hospital just in the last year. And that, like, when you think about a patient, a family, your staff that is taking care of a patient that doesn't need to be in the hospital, that is an absolutely wild and incredible number. Our PAT solution that launched about that time frame, we've been able to both see improvements in productivity, significant improvements in productivity. We've seen reductions in cancellations, almost 500,000 minutes of documentation time for MDRs and such removed. We've seen significant financial impact, $150 million in surgical contribution margin, $50 million of savings in cost through the excess days. But a lot of it has been through both the machine learning, through the technology, but through the work we've done hand to hand, working together, all of us together. So thank you for that. I'm super, super proud of that. But that takes me to where we are going. I think as exciting as the work we've done together has been, we're at a really unique moment in healthcare. There is a massive opportunity in front of us of what we can do now. I mean, I've been doing this for 13 years, and I don't think there has been a moment in time where I've been more excited as to what is possible than now. You know, healthcare oftentimes in the past waves of technological improvements, whether it's the digitization through the EHR or machine learning or through RPA, hasn't fully unlocked the level of transformative impact we wanted. And oftentimes, I think some of the struggle has been healthcare is a very human field. So a lot of our interactions are unstructured, our data is unstructured, sometimes our workflows are unstructured, and that makes it challenging for technology to do that. But this wave of technology is actually exactly suited for dealing with that kind of unstructured information, data, workflows, and people interactions. And therefore, it feels like this is our moment to leapfrog all the different technological waves that we've been in the past. But we also know that it's not quite as straightforward. I think there was this MIT study, I'm sure many of you saw it, even there was some stock market kerfuffle caused by when this first came out in some of the AI stocks. But it said 95% of the Gen AI pilots were failing. And if you read it, a lot of it is the same lessons I was sharing from our journey repeating themselves. So I'll give you a couple of examples of it's not the machine learning or AI, but everything else around it being important. So the first one, which always makes me chuckle a little bit, is this example of McDonald's drive-through. So as you drive through, instead of a human sort of picking up and asking you what you want to order, they put an AI voice bot to go do that. Makes a lot of sense. Soon after, a bunch of viral TikTok videos start showing up about this, which I think if viral TikTok videos start showing up about something you've launched, probably not a good idea. And one of the funny incidents was a person driving through and ending up with an order of 260 chicken nuggets, which is a pretty hilarious, funny incident to happen. But if that happens in a hospital with a patient, that is not quite funny. That is like a problem of real consequences. It's a failure not just of technology, but of care. And there are many examples like this. I mean, there was this other example of Zillow. I'm sure many of you in your home buying process at some point have seen the Z-estimate scores, which were fine when they were just sort of recommending something and they built a whole buying business based on it. They kept buying sort of at higher and higher and higher prices, and then sort of it all went down. So a lot of these examples are examples that show us that as much, I think, in the world of Gen AI, that a demo has become 10x easier, operationalizing that AI has now become almost 10x harder. So why is that? I think if you think of how software used to be, we were in a world of deterministic software, right? So if I just told the software, do this, it did that reliably every single time, all the time. Contrast that with a human, you kind of have to repeat all the time, like, hey, make sure to do this, make sure to do this. But also, because the human doesn't always follow exactly what you say, they also don't have to be given the exact instructions of what you want to say. And they're able to go figure out a new situation, and therein lies their creativity. Therein also lies all the work of managing people that is not quite as straightforward as telling a computer what to do all the time. I think Gen AI is in a lot of ways very similar to that. It has more creativity. It can do more than we expect it to, but it can also do things we don't expect it to. And that changes the nature of software. It changes the nature of software from being deterministic to being probabilistic. And that changes a lot of things that come with it, right? So for example, before, if I was comparing two pieces of code or two software, and I would say, okay, this is 70% as good, or this is 100%, I knew what 70% it would do all the time, and the 30% gap that remained, and how I would lead to solving that 30% gap. But in a world of probabilistic software, that's different. That error compounds. So I'll show you here in a little simulation we built of what that does, but that error now compounds. So this is just a very hypothetical sort of example of a deep AI that we built, let's say, to have 99% of the use cases handled, and a shallow AI that sort of does a quick and dirty and handles 80%. Think of these as patient interactions, and the red are areas of escalations. It's not able to handle, and it's going off track, and you need to do something about it. As the use cases get more complex, as interactions repeat with the user, those errors compound. And you can see very quickly that difference of 80 to 99 that didn't feel as big starts to become very, very meaningful. Either it overwhelms your staff with just a degree of escalations you can't do, or worse still, someone ends up with the equivalent of 260 chicken nuggets, which you do not want, right? And that, I think, is one of the key pieces. But when we think about going ahead, we think about not just building the platform to deploy AI, but the platform to operationalize AI. And I think that sort of brings us to the future of the AI platform, which is how do we take all those learnings we've built over the course of time, which are now even more important in the world of applying it to Gen AI, and build them together to give high quality, consistent ROI and outcomes that you've expected before. Jeff's going to share more about our platform in his talk, but it's built on those same pieces, those models and machine learning models that are localized and probabilistic for you, the different data sources that come together, the decision optimization, the behavior science, the AI assistants built on top of it, all of those pieces working in concert to make sure that we can actually productionalize the pieces that we build together, and it's not just a demo. Our AI operational assistant layer in particular has also been evolving over time. I think of it like this is a set of teammates that each of us can have more capacity to execute within our institutions through. And just like your best teammates know for different situations when to perhaps come to you and say, hey, I have a problem, or I have a problem, here's some solutions, here's how we should solve it. Let me know. Unless you say no, I will go do it. Or the best ones is like, hey, by the way, I had a problem. This is the issue. We solved it. Don't worry about it. And that's the best thing you can have. But you need to flex across all of these depending on the use case that exists. And I think which is why when we build the platform, it is not just about applying AI to automate a step. It's about going all the way from those data steps to the prediction steps to optimization to what decision you should take. Because for different parts of a problem, we can apply different pieces of this. So as we've built sort of these pieces together, and we've had conversations with many of you, you've all been telling us of this similar belief that the operationalization of AI is often the less understood art and science of getting the outcomes from these technological advances. And this belief around like building these pieces together, but wanting us to go faster across the patient care journey beyond what we've done today. So today I'm really excited to announce for the first time for this group in here, the Qventus AI Solution Factory. This is going to bring together the package of those platform capabilities around operationalizing AI with the work of marrying your clinical expertise, your operational expertise, to go deep into specific solutions across the entire patient journey. But by bringing these platform components together, we're being able to do that at a much, much faster rate than ever before. I want to have a little video play of sharing with you what that looks like here in a second.
Thinning margins, labor shortages, declining reimbursements. The pressure on health systems has never been greater. Every day, your teams must do extraordinary things just to handle ordinary tasks. You've asked for a better way, a way to apply AI to solve operational challenges at scale. Introducing the Qventus AI Solution Factory. It's a new paradigm for automating care operations. For over a decade, we've perfected the engine, a platform that integrates with your EHR and understands everything from a fax to a patient call. Now the factory turns that engine into your custom AI workforce. At the heart are AI operational assistants. They aren't just tools, they're teammates. They read, write, speak, and understand, always 2 steps ahead. And now they have powerful new skills. chart mining, instantly extract and cite patient data. Continuous risk determination, identify and triage at-risk patients. Care gap orchestration, close gaps to prevent delays and prep patients for surgery. Intelligent document management, end the paper chase by digitizing and routing communications. Patient concierge, handle intake, appointments, and outreach across voice, text, or email. Call center assistant, support clinicians with real-time insights, follow-up automation, and coaching. With the Qventus AI Solution Factory, we don't just solve today's problems, we give you the blueprint for the future. Automate the chaos, secure your margins, own your mission with Qventus.
So you've all been already bringing many use cases to apply this AI Solution Factory to us, whether it's your ambulatory practices, whether it's post-acutes, whether it's call center. I am super duper excited to work with you to build these, to get these to you at a much faster pace. Now, to be clear, I'm not talking about 200 use cases that are shallow and we just want to plaster them out and we want to get a press release saying we have so many different use cases. That is not our mission. We want to do it the Qventus way with you. We'll go deep with you on problems. We'll build the best of the agentic AI capabilities with the operational and clinical expertise that you and your staff have to go deep in these problems and to go after problems where not only can we deliver a strong margin, strong mission outcomes, strong patient outcomes, and also alleviate a lot of your staff's burden through that as well. I just want to say thank you again to all of you for being here, for taking the time away from families, and spending the next day and a half with us. We will have a lot of time to hear from your peers. We'll have time to listen to some of the newest advances we are making. And for me, the funnest thing is to actually get to hack and build some new things together. So thank you again. Really excited for you to be here. And thanks for taking your time.